According to ICD-10-CM coding guidelines for Chapter 1, code only confirmed cases of HIV infection or illness. This is an exception to the Hospital Inpatient Guidelines Section 2, H. In this context, confirmation does not require documentation of positive serology or culture for HIV. The provider's diagnostic statement that the patient is HIV positive or has an HIV-related illness is sufficient. Asymptomatic HIV, assigned code Z21, asymptomatic human immunodeficiency virus, HIV infection status when the patient, without any documentation of symptoms, is listed as being HIV positive, known HIV, HIV test positive, or similar terminology. Assigned code B20, human immunodeficiency virus, HIV disease, on the claim when the term AIDS is used, when the patient is being treated for HIV-related illness, or when the patient is described as having any active HIV-related condition. Patients with inconclusive HIV serology, assigned code R75, inconclusive laboratory evidence of human immunodeficiency virus HIV, when the patient's record is documented with inconclusive HIV serology, but there is no definitive diagnosis or manifestations of the illness. Previously diagnosed HIV-related illness, code B20. If you document a patient as having had any known prior diagnosis of an HIV-related illness, Z21 is no longer reported. If the patient develops an HIV-related illness, they should be assigned code B20 on every subsequent admission or encounter. HIV infection in pregnancy, childbirth, and the puerperium. Assigned code 098.7. Human immunodeficiency virus, HIV disease complicating pregnancy, childbirth, and the puerperium first when a patient presents for treatment of an HIV-related illness during pregnancy, childbirth, or the puerperium, followed by code B20. Also, assign additional codes for HIV-related illness, EAS. Keep in mind that codes from Chapter 16 take priority when sequencing codes on the claim. If a patient with asymptomatic HIV infection status presents for a routine visit during pregnancy, childbirth, or the puerperium, the correct code assignment would be 098.7, followed by code Z21. Assign code B20 for all types of HIV infections, which may be described by a variety of terms, including AIDS, acquired immune deficiency syndrome, AIDS-related complex, ARC, AIDS-related conditions, and HIV infection symptomatic. Testing for HIV, assign code Z11.4, encounter for screening for human immunodeficiency virus, HIV, when seeing a patient with no prior diagnosis of HIV infection or positive HIV status to determine their HIV status. Code the signs and symptoms when seeing a patient with signs or symptoms for HIV testing. If you provide counseling during the encounter, assign additional code Z71.7, human immunodeficiency virus, HIV counseling. Assign code Z71.7 if a patient's test results are negative for HIV. Assign code Z72.8 if a patient is known to be in a high-risk group for HIV infection. Other problems related to lifestyle can be assigned as an additional code. Major HIV-related conditions include pneumonia, unspecified organism tuberculosis of other sites, sepsis, unspecified organism candida stomatitis, also known as thrush herpes zoster, which can occur at any site, encephalopathy, unspecified tinea cruris anemia underweight acute lymphadenitis, arthropathy splenomegaly, not elsewhere classified, and weakness.